Hi, everyone, and welcome to the Ontario-NEIHR Webinar Series 2023. Today, we welcome Kimberly Fairman and Dr. Sophie Roher. Their presentation will be Elders Gathering, A Path to Healing. If you look in your chat shortly, I'll be posting a link for a survey. If you can complete sometime during the presentation. And I'll also be posting our link to our Ontario-NEIHR website. And now let's welcome Dr. Sophie Roher and Kimberly Fairman. Miigwech.
Thank you, Roy, and thanks to everybody for joining us. I see some familiar names in the participants list, so that's really nice, and some new names. And so I'm hoping we're able to give you a sense of some of the work that we did earlier this spring. And I'm really excited to engage a little bit more after the presentation and hear comments and questions and feedback on this work. So no, just one second. I'm trying to get myself organized a little bit in terms of what we're doing. Okay, so we're going to talk a little bit today about a gathering that we held in April at the Institute for Circumpolar Health Research, and where we brought together elders and knowledge holders from across the Northwest Territories, which is where we're from and where we're working. And we had a few goals around health and wellness priorities, talking about the strengths that exist in community as well as the challenges when it comes to well-being, and then really hoping to provide a bit of a framework or some recommendations for researchers, with priorities that we're supporting people who live in the communities in the Northwest Territories. And we also have a similar to, the host here, who we also partner with, we have a NEIHR grant in the Northwest Territories, which is focused on creating an environment that is supportive of graduate studies for Indigenous students and Indigenous communities working in health research. And so some of those discussions did and are informing how that some of the work in that grant proceeds as well. So I think we can go on to the next slide, Sophie. And by the way, these pictures are all so beautiful, and this is where we live and work. And so we wanted to really try to give you a sense through this presentation of where we are and who we're working with. So and so now I can talk a little bit, just a quick introduction of myself, although I think most of you may have seen the bio in the event schedule. I also like to just talk about, the fact that I am a mom. I have 4 kids, and I have 4 grandchildren who live in Yellowknife in the Northwest Territories, which is where I live and work, but I'm originally from Nunavut. So I'm Nunavut, and I have moved back and forth between the 2 territories during my work and schooling, and also my personal time, I guess, because I do like to spend a lot of time on the land in both places. And I'll hand it over to Sophie to introduce herself.
Thank you. And I want to say thanks to Clay for that beautiful opening and for having us here presenting today. My name's Sophie Roher. I'm a settler of Jewish and mixed European ancestry, and I recently completed my PhD in public health at the University of Toronto, and I've had the pleasure of working over the past 8 years at the Institute for Circumpolar Health Research in Denendeh, Northwest Territories. And while working there, I've had the privilege of being able to work on health and wellness projects that have been led and identified by Indigenous elders and community partners in the North. And so this is, today's presentation is one of the many projects that ICHR is part of. I'm a postdoctoral fellow at the Well Living House right now, which is an Indigenous-led action research center located at St. Michael's Hospital in Toronto, and I'm a senior research advisor at the ICHR. So just a brief overview of our presentation here today. Kimberly is going to provide a history of the ICHR and give a bit more detail about the Northwest Territories NEIHR. And then I'll give some background on the elders gathering and how it kind of came to be and how we carried it out, what it looked like. And then we'll discuss some key themes from the gathering and next steps. And we're hoping that it can open up a discussion and kind of get some questions. And we'd love to hear from you about your experiences with capacity bridging and elder support and research.
Great. Thank you, Sophie. So just a little bit about the Institute for Circumpolar Health Research. It's an independent nonprofit organization, and we're leading research in the North for the North. And so what we mean when we say that is, as an organization, we were established early on to address sort of a gap that existed around health policy research that addressed the needs of the people who live there. And so there were a number of people that came together with that vision who were community members and were practitioners and researchers who were living in the North. And they really established this institute to facilitate and train and synthesize and exchange and translate research for the people who live there. And I feel like, you know, that goal hasn't changed over the years, but certainly we've been learning more and more as we're present in the North, how to do that and how to do that in a way that really engages community in a deep way around the planning and the execution and then the sharing of knowledge. So you know, that belief about advancing the health and wellness of Northern people and communities is one that continues and one that we try to really reinforce with the scientific community and also, you know, in terms of public policy. So the organization really has just 3 main objectives, and those have been consistent over the years, and that's really about conducting and facilitating ethical research that is used to improve health and wellness and importantly, reduce the disparities that exist in the Northern communities and Northern residents. And then this second step of synthesizing and disseminating and exchanging knowledge. And so when we use the word exchange, it's hugely important to us that this is about a dialogue. So findings, of course, are shared in the scientific community, but importantly shared in community. And it's a really interesting exchange, because I've learned over the years that, you know, when we present our findings, often our work isn't done, and there is, you know, there are more questions that are generated and more thought that goes into digging deeper on some of the issues. And the third objective is to conduct training and to educate Northern stakeholders, as well as our research partners on health research methodologies. And so again, just highlighting the fact that this is a two-way street. It's not about, you know, knowledge moving just one way. This is really about engaging. It's about relationship, and it's about sharing what we learn and learning from what we've shared. Thanks, Sophie. I was going to say, should we go on to the next slide? But you're reading my mind a bit here. So also just a little bit about the NEIHR grant. So the ICHR currently holds a NEIHR grant, which is one of 9 across the country, and we're funded by the Canadian Institutes for Health Research. We have a governing council that sets the priorities and the strategic direction for the grant, and it's made up of 4 members from the Northwest Territories who have been hugely influential and generous, I would say, with their thoughts and their time around how to do this, how to set these priorities in a good way. And that includes an elder, Francois Paulette, who's the chair of the council, Besha Blondin, John Bizot, and Racine Neshalik. The thing that I am most struck by with the governing council is their commitment to nurturing Indigenous culture, and that is at the core of the governing council. So that comes out in all of our discussions. You know, this idea that elders and knowledge keepers are support sort of the cultural alignment of the work that we do and the values that underpin that work. And so this is something that we spend a lot of time reflecting on, reminding ourselves of, and incorporating into the work. And the values for the NEIHR are really around building capacity, so supporting Northern youth and undergraduates, as well as high school students to understand health research and health-related careers. There's real recognition that the youth and people who are entering into university are the future of this work, and that they have ideas and they have strengths and things that we need to really nurture and support in order to achieve the vision of the NEIHR over the longer term. We also aim to conduct community-based participatory research by supporting Indigenous communities and organizations to develop research projects, but also again prioritizing what the communities want to explore and investigate, and using the values of community to underpin that research. We've worked really hard on value around co-learning and using strategies to develop curriculum and training materials that support co-learning. And so with the elders and knowledge keepers, we always think about how, again, knowledge is being exchanged and shared in a way where everybody is benefiting from that experience, and reflecting on how co-learning is as a value is something that really helps us work towards this goal of having a supportive environment for health research. And I think part of the reason that we focus on that, whether it's between elders and youth, or non-Indigenous researchers, non-Indigenous students who are coming into community, is that we all have to be in that learning mode in order for it to feel safe and for people to be receptive around some of the really hard lessons that community is offering us, and the change that is required in the way that research is done. And so we feel really strongly that in order for us to reach those goals, we really need to create safe space where everybody is in a learning mode, and we're all sort of benefiting and reflecting on how challenging and rewarding that learning mode can be. And the fourth goal is around knowledge translation. So really trying to create and bridge partnerships with NEIHRs and across the country, Indigenous communities, northern regions, and increasing the awareness among decision makers, you know, around the importance of Indigenous knowledge, and using community priorities, community methods, and Indigenous knowledge to generate evidence in health research. So that's how our NEIHR is, you know, using or partnering with community and using the knowledge that they have to offer to try to really expand on some of the goals around, you know, safe learning environments for Indigenous health research. So this next slide, I'll just talk, well, I'm not going to talk about each of the guiding values. And I think, you know, if people are interested in some of this information, it is available on the website. And so I'd encourage you to have a look there, and also to see who else is involved in the NEIHR. But when we talk about our guiding values, I think what I would mention here is with, you know, if you took any of the values, say courage, for example, we do talk in the NEIHR about the underlying value itself and what it means and how it looks when we are working and using that value in the work. But we also recognize that each of these values has, you know, individuals have different capacity for them at different points in their life. And so with the elders and with their guidance, we're able to explore where people are, right, in terms of courage as like being able to express that value in their work. And certainly when I think about my own ability to demonstrate courage in either my work or my personal life, there are lots of things that impact that, right? So, you know, sometimes it's as simple as whether or not I'm having a good day, right? Or whether I've been challenged a lot that day, and how that value gets expressed. So we use a lot of flexibility when we think about these guiding values and how they are expressed in our work. Humility is sort of one way that we approach the use of guiding values in our work. So understanding that people, you know, depending on the context or their own, you know, place in life or their own level of learning, all of these things sort of impact our ability to express these values. And I think that's a real rich conversation and a really rich learning that I've had working at the ICHR and working in the NEIHR, and having the elders you know, make space for varying levels of being able to express values in our work. And, you know, always striving for, obviously, you know, to be able to do that better, but understanding that, you know, this is all about process, and it's about growing and learning together. And so these are our, you know, goals around the values. And sometimes we need to be humble and creative about, you know, finding ways to express that. I don't know if you want to add anything there, Sophie. I've been talking a lot, and I know you and I have had some discussions about this, but did you want to jump in there?
I think I'm just thinking about how when you're talking about the values, about how we brought in some of those values to the elders gathering also. So I just feel like I'm learning right now, but I'll bring that in when I'm talking about the gathering. Mm-hmm.
Okay, great. So let's go through the next couple slides and really get to the meat of, because I'm also conscious of time now. So in terms of the Governing Council, we did develop a governance framework. And this was interesting. We were also doing this during the period of COVID. The grant was awarded right before the lockdown started. And so there was a lot of things that we had to learn how to do virtually. And it took, a lot of time and discussion. But when it came to the point of having to develop a framework or to, articulate what the values were from the previous slide, we had spent a lot of time together in this learning mode, trying to figure out how to work together virtually, how to incorporate, a lot of the elders' learnings in ways that we hadn't used before. But it was really interesting because when we came to the point of developing the framework, it really came together quite quickly. If I remember, we spent a day using some of the frameworks that exist in elders communities and in their work. And we came up with a model that we were all really comfortable with. And it was really about how do we, work with traditional knowledge in a way that is protective, but that promotes the sharing of traditional knowledge and the growth and use of traditional knowledge. And so in our practice, whether it's, a daily practice personally or in our work or in a professional sense, bringing all of these things in and, all of that leading to a preservation of culture and language and way of life. And how we can support that in the activities of research. And we also really try to articulate what are, to not shy away from activities like caring and acceptance and sharing in the work that we do. I think sometimes we can forget about when there's pressure to do work and we're trying to move ahead with making change, that we need to make space for those important activities as well. And so the next slide. Oh, and this I love this slide. So this is a picture of the elders who are on the Governing Council. Oops. Oh, did we take that one out? Yeah. Okay.
We did, but I can put it back in.
Well, no, maybe we can show it at the end. I'll let you go on and talk about the elders gathering.
Sure. So the idea for the elders gathering came from the NEIHR Governing Council. And as Kimberly mentioned, there's 4 members of the NEIHR Governing Council, and they really underscored the importance of having elders and knowledge holders from throughout the Northwest Territories come together to identify and discuss community health and wellness priorities. And so we at the ICHR, we worked closely with the elders, and particularly with Elder Francois Paulette, who's the chair of the Governing Council, to organize and coordinate the gathering. And so we held it in April on the 19th and 20th. So it was a 2-day gathering of elders and knowledge holders, and it took place at the Explorer Hotel, which is in Salm-Bikay territory. It's on the traditional lands of the Yellowknives Dene First Nation and North Slave Métis Alliance in Yellowknife. And the gathering in total, it included 22 elders and knowledge holders from across 15 different communities. And you can see everyone here pictured together. I think Kimberly's giving a presentation here and like introducing the NEIHR, and Elder Francois Paulette is sitting beside her. So, and it was really an incredible group of elders and knowledge holders. It was an honor to be able to be there and kind of be witness to the event and listening to the elders talk about priorities that are important to them and their communities. So there were 3 kind of general objectives for the gathering. So the first was to identify health and wellness priorities in Northwest Territories communities, then to consider strengths and challenges to health and community well-being, and to develop recommendations and research priorities to support healthy communities. And then, so these were kind of the objectives for the gathering for what we are going to talk about in general, but an additional overall goal that the ICHR also held for the gathering that we shared with the elders was also to try to inform the direction and strategic activities for the ICHR's Network Environment for Indigenous Health Research grant, as Kimberly mentioned, which is meant to strengthen Indigenous health research capacity in the North. And this was important to the Governing Council and had been kind of brought forward by the Governing Council as a reason to kind of try to hold the elders gathering. And just as a kind of side note, the gathering was also important because many of the elders hadn't seen each other from COVID. A lot of people had been in their communities. So this was also an important time, as Kimberly talked about the guiding principles and about the NEIHR values. It was important to also have time for the elders to see each other, to reconnect with each other in person, to have a lot of informal time. And also we took a lot of care in ensuring that the process was really respectful and beneficial to the elders. We had an incredible person and part of the ICHR team. I think she's here today joining, Sally. And Sally wrote handwritten letters to all the elders. One of them referred to them as love letters at the end, but really there was a lot of care in trying to provide also traditional foods every day to the elders, and making sure that we were really listening, especially iteratively, as the gathering was continuing on. So in addition to the elders and knowledge holders, the gathering was also attended by ICHR staff and by a few PhD students who helped to volunteer at the gathering, and then 2 Indigenous researchers who presented on their community-led and culturally driven work. So you can see here on the left is Becky Koska. She's presenting here on her work with Smith Landing First Nation, and they run an land-based camp where they also do research on fish health and the health of the community, and passing on knowledge intergenerationally. So the elders really valued that work. And then we also had Jessie Cardinal present from Keepers of the Water on the work that she's doing, the advocacy work around Tarzan tailings being kind of, and toxins being dumped into water, influencing communities. So, and then finally, we also had a facilitator who was wonderful, who helped to discuss some of the objectives for the gathering, so helped to facilitate those kinds of discussions. And you can see on the right here a kind of image of some of the things that the elders brought up in the gathering.
Thanks, Sophie. So from the gathering, we've got the high level themes that came out of the gathering here, but I also just want to preface this with, the fact that in order to get to this place of the high level themes, we've had quite a few follow-up discussions within the team, as well as with some key elders from the group, to ensure that we were capturing, over the 2 days, really the heart of what the elders were talking about. And I think the other thing to recognize here, in terms of the themes, is that it was really, really amazing to focus on, what Sophie was saying around the elders coming together in a way that was comfortable for them, focusing on relationship. And what happened in the discussion was there was some really deep sharing around some contextual pieces in the communities, a lot of sharing around history and elders' reflections on, historical and contemporary sort of strengths and challenges in the community. And so like we have the themes here, but I want to underscore how important it was to have the time for the elders to express a number of really deep insights around these themes, and that will really guide us, right, in terms of priorities for health research in the communities on a go-forward basis. And so through all of that discussion and sharing and reflection, the themes that we are going to be moving forward with are around recognizing the ongoing impacts of colonization. We really heard a lot about the strength that exists in community for culture and traditional ways, and how that needs to be incorporated in every research activity that we undertake, and how research, overall can be used as a vehicle for decolonization. And, I think what was really important for us to recognize is the time, the commitment, and the the strength that needs, like involving the elders in any work that we do in the future. I mean, it goes beyond just sort of being interested in reflecting community priorities. There is what I learned from that gathering is, the difference between being interested in supporting community versus being committed to supporting community. And, those are, in my view, two really different things, and they can't be done without elders' support and involvement in research. So the next slide, yeah. So in terms of next steps, we've done a couple of things. So we've created a video of the gathering that will be shared with participants only at this point. It was really about being able to capture the interactions and the discussions over the 2 days, so that the elders can use that as a tool to reflect on what was shared and coming together, and just to create a bit of a memory. We have a report that will be coming out from the elders gathering that will capture some of the discussion, again, what the high level themes are. And then we will be, really thinking about how to encourage relationship in the communities between researchers, community members, students, and then how to continue to nurture those relationships while working on research that addresses those high-level themes. So really encouraging, whenever a project sort of comes across at the ICHR or at the NEIHR, for people to think about how the research is going to talk about the impacts of colonization and the ongoing impacts, that there's a real action that needs to be taken in the research, and then really highlighting language, culture, and way of life as part of the planning activities in the research, and how we can support language, culture, and way of life through those activities. And then in the sharing of research, again, how do we work towards decolonization in all those steps? And I don't know if there's anything you want to add, Sophie, there.
I guess I would love to hear from the group here about if you have had a kind of hosted a similar type event, or how you think about engaging elders in research, or about how, I don't know, different ideas around kind of capacity bridging as well, recognizing that, because I think also something we learned a lot about, which was really important for where like I heard, at least personally, was just a lot of the elders and entrepreneurs who were at this event really wanted to talk deeply about what research means and how we can think about it in a new way, and actually maybe even renaming what that is, and So there was a lot of really kind of deep discussions around what research could look like when working with community as well. So at this point, I didn't create a thank you slide here. So this is the end of the presentation, but if you have other questions or would like to share about your own experiences, I believe you can put it in the chat. Oh, it looks like Janet Smiley has a question.
I can't, oh, there we go, okay. Yeah, thanks for joining, Janet. The format, like I can't actually see participants, but I'm really grateful for everybody who decided to join in, and I know people are busy, so it's really fantastic. And in fact, the other thing I would offer is if people want to reach out, I think there's like on the website, certainly there's contact information. So, if you feel like afterwards there were questions that didn't come up or that you wanted to discuss more, I think Sophie and I are both open to making those connections. Yeah. And is that you have 2 ideas for a discussion? So Janet's just saying, I wonder about being more specific or modifying participatory action research. Yeah. Yeah. And one of the things that comes up actually interestingly in communities that we engage with, and I think it's really important what you're bringing up about modifying participatory action research or using that approach specifically. One of the things that we've learned through the NEIHR and through this engagement is that we need to do a little bit more work around community describing to us what research is and how they would undertake research, so what those methods are. And I think participatory action research leaves a lot of space for that. I think one of the things with having the Elders Council and with having that level of oversight and support is it gives me a lot more confidence to explore, methods that are generated in community and are validated at the community level. Yeah, exactly. So what you're saying there, I think we're moving well beyond, empowering in Indigenous context. Yeah, exactly. And so I agree with you 100%. And I think that's the real richness and benefit that comes from having community members involved at the governing level and then in, each of the research projects that we do. It just gives you an opportunity to really go a lot deeper into this idea about concepts that are rooted in a specific language or, what paradigms and protocols actually we're able to use and expand on in that context. Yeah. And this idea about translation of ideas into English is a huge one as well. And this comes up not just in the NEIHR, but in almost every discussion that I have in any of my other research projects and working with community, is that like translation is a huge barrier. And one of the things that I've realized is that when we are using translation, how important it is to spend time with translators, how important it is for the translators to be involved in all the steps leading up to actually executing the project, because that richness of being able to truly like interpret, right, in the true sense of interpreting, it's much more than just the words that are used. And I think that's a really important point to bring up, and so thanks for raising that. Yeah. And that was also, that's a last comment that you had there about when we're using English language and the concepts and paradigms may be very different. I think we take that for granted a lot, and we've learned through this as well, that when we're using terms in our research and in the planning, that it's really important to take the time to explore what we mean. You know, when we're saying, using a term, or, you know, what does that actually mean? Yeah, maybe there's another question there, but maybe Sophie, would you want to address this question about the youth and the discussions or intentions on how to bring elders and youth together? Because we did also explore that, and then I'll go back. There was another question up top.
Sure. I think that's also something that was brought up in the gathering also, was about transforming approaches to build on the strengths that elders and youth and adult bring, and also about how to build those intergenerational connections and build on those intergenerational connections as well. There was a lot of discussion that we're going to kind of be fleshing out more in the report around the involvement of youth and elders and in research. So I think that's a fantastic point there, especially as communities are doing more and more of research. And like you said, the research, this idea that the researcher is an outsider can be kind of an outdated concept in many communities. So
yeah, and I think the other thing that the elders raised, which I thought was really important, was that youth need forums specifically for youth in order to feel, have those discussions initially, feel really confident before moving into, you know, discussions with elders or researchers around, you know, some of this, the things that they feel are priorities. And so that was really something that I took to heart as well, is how do we create safe space where you can discuss these things, feel really confident going in that they've got consensus around, you know, what the priorities are and how to address them.
there was a question about operationalizing the idea as well.
Yeah, and that's a really important question. I don't want to underplay how difficult this is. You know, through the discussions that we've had with the NEIHR, through trying some of these things out in either student projects or research projects, this is a really challenging area. And so we come across all the time barriers systemically, barriers in our own thinking around what this means. It takes a lot of, again, like I said, commitment, you know, to work in this way and to start to reframe research where you're upholding priorities in the community. And so just to give you a sense like what this looks like, it is really about reimagining, you know, research methods. So for example, with the elders gathering, let's use that one. We had some objectives around bringing the elders together, but what it meant for us was to really let go of what we thought the gathering should look like, or having goals around how to meet those objectives. And we really just said to the elders, we want you to come together what is it that we can do to support that? And what do you want to talk about? And what should the day look like? And so we really just released all the elements of the planning and the agenda to them. And sometimes, we were in that process, we were wondering, are we going to get what we wanted out of the gathering, or is it going to go the way that the elders expect? So there's a lot of, there's a lot of uncertainty. And I think as a team, we talked about those things, but then we also really committed to doing things the way that the elders wanted to do it, and talking about the things that the elders wanted to talk about, and living with that discomfort around, are these things matching up? And so I don't know if that answers the question, but maybe what I'm trying to say is it takes a lot of courage and it takes a lot of trust. And so we've developed really strong relationships with our governing council members, as well as with the communities that we work with. And so that's what gets us through, right? When we're struggling. And even at the end of the day, I've had experiences where I think I've come up with something that seems really novel to me. And I think we've done a lot of work in trying to express it in an authentic way. And I get feedback from the community that, no, that's not actually, what happened or what we were thinking. It's those moments where you're, when you talk about operationalizing, that it's really challenging, and we work on it all the time.
And just to build off of what Kimberly was saying, like the elders gathering, we really put the primary purpose was for it to be beneficial to the elders. And so that's why it was also just so valuable important to prioritize. That's what the research is all about. And the elders also they just know what is important in the communities. They're the primary kind of knowledge holders there. So I think it's just, there was no other kind of way to go about it other than to really prioritize that. Put that above, and that sometimes that's hard for researchers to understand, but to put the elders' priorities and values ahead of our own.
Okay, so there's a question there about, are there cross-disciplinary opportunities to ensure engagement with communities does not add to engagement fatigue by creating new governance structures? Yeah. Example, is there a possibility of an elders gathering to inform both health and environment research? So that's an interesting question. And I think a lot about this. And I think this is really important, but I also feel like part of the way that we address the idea of fatigue in communities is by releasing our agenda a little bit. I think the way that fatigue happens, and I've seen this before, is where people are coming and they've got all their questions, or what they want community input on. It's already sort of predetermined. I think the difference about the way that we're working is that we envision the whole process as supporting the activities that community actually want to do, right? So we, for example, I've got a project next month in Nunavut where the whole concept of it started from community wanting to do a fall fish camp. And so we, looked for ways to support that activity. And as we started developing the project idea, the research questions started to emerge. So to me, there's a difference, right, between coming with your list of questions or coming with your agenda and, pushing community in a certain way to provide feedback or to engage at that point, versus having a community come to you and say, well, we really want to do a fall fish camp, and these are the questions that we have. I know that doesn't answer the and I know there is still this research that occurs where, of course, communities are, they're tired and they're not ready to input. I think the other really key thing that I want to mention here is that if you think back to earlier in the presentation where we talked about the formation of the Institute for Circumpolar Health Research and the fact that we began the organization to recognize that people live in the North and that we undertake, activities in those communities. What I want to point out and what I think is hugely important is for researchers to consider how they are helping to address the inequities that exist in community that prevent them from participating in research as full partners. This is something that I think about all the time. How do we ask community members to come to the table when they're worried about where their next meal is coming from, or whether or not there are jobs in the community for their children or their family members, like housing, how do we as researchers think about our overall responsibility to address those inequities so that community members have, the focus and ability to start thinking about where they want to put their energy.
Thank you, Kimberly and Sophie, for that wonderful presentation. Unfortunately, we are running out of time, but I would like to thank everyone for joining us today. And the webinar will be available on our website within the next 24 hours. So if anyone has missed part of it or wants to watch it again, it will be posted on the NT-NEIHR website, which is, the link is in the chat. So now I will hand it over to Clay, and he can close us out in a good way. Miigwech.
Oh, great. Miigwech, thank you. Thank you, my sisters, for all. I just want to thank you all for all your hard work and everything and what you're doing in the North. And I really appreciate, in my limited experience with elders and knowledge keepers, I think it's very important, and I heard that from you, is give them the time to get to know each other, to do ceremony. That's the most important thing that I keep saying over and over to all researchers from all different places. They don't all know each other. Right? It's a vast universe, all of this. So that taking them, they have ancestors behind them. One of them I know is Francois, and he's a very powerful man. He's a very kind man, and he works in the sweat lodge, and he works in there. Long history and everything, and so it's very important. And I just want to thank you again for doing that, taking the time and recognizing that it takes for them to get to know each other and do ceremony, right? The practitioners of their ceremonies. And as far as I'm concerned, the way I see research is ceremony is research, right? And that's one thing I've learned over the years from my elders and all of this, and seeing that. And again, my hat to you, my sisters, for making that space for them. That's you guys are ahead of the game there. I'll just put it that way, right, when it comes to that. So thank you, my sisters, for doing that. It's so important. Our elders are the knowledge holders, and I always remind our youth, take advantage of them in a good way, in a kind way. They're not always going to be here. So listen up and all of that, and gather that knowledge that they have for you. So with that, I want to say miigwech to you. And I just say miigwech to our ancestors for being with us in a good way, in a kind way. And I say all my relations to you. Bama P.
Thank you.